Dr. Avi, if you're ready. A man who fights death for a living, not with weapons, with his hands, a scalpel, and a refusal to give up. A notable person on Israel's first trauma unit to rewriting the global playbook on blast injuries, with a simple yet profound quote that I wanted to mention to you.
Okay.
Every person deep down just wants to stay alive. A man who
don't have any remarks about it, and you should put full stop.
100%, sir. You're a man whose phone has never been on silent, not once in 30 years.
Not even here in Nepal.
Not even here in Nepal.
Yes, I was waked up this morning by phone call about a 94-year-old man, the father of one of my friends that is now in the emergency room because of a urinary sepsis. And he asked me what to give, what to do, CPR, not CPR, and all this stuff. So I told him, you know my answer. He said, okay, I want to hear it. He told me, first of all, he called around 2 in the morning, 2:34 in the morning. In Israel, it's 4 hours before, so he didn't have the clue that I'm here. And he told me, listen, I wake you up. I said, okay, so close the phone, never mind. I said, you wake me up already, so...
Ask me the question.
Ask the question, what the problem? I knew it's a medical problem. It's like my residents. You know, the residents are calling me at 3 o'clock in the morning, and they're telling me, Professor, we wake you up? I said, no. I expected your phone call. 2, 3 in the morning. Like, I'm joking with them.
Yeah. But if they call you, you will not going to mind. Because at 2 a.m., somewhere someone is bleeding out and you want to take that call. That's what you said. So, Dr. Avi, welcome to the show called On Air. It's a pleasure to have you here.
Yeah. Mutual pleasure. I didn't know until 10 minutes from now. I didn't know you even. But I like you. It's okay.
No, I'm glad, Dr. Avi. I'm glad. I'm glad that you are here. And again, like I said, my team's created 1,000 questions, but I want to stick with a few that I really, really wanted to ask you. Dr. Avi, what, a kid who was in the military police with zero medical knowledge when you were 20 years old, ends up becoming one of the top trauma surgeons in the planet.
Okay.
What's the story behind that?
Listen, when I was young,
yes,
I'm still young.
Of course you are.
But when I was young, I was in the army. It's obligatory to be in the army in Israel. You have to be in the army. You're proud to be in the army. You want to be in the army. And I was a single son to the Holocaust survivors. My parents are from Poland. The story about my father is complicated because he ran away from his hometown, Białystok, in Poland. And he ran away with his family, meaning father, mother, and sister, to Brody in Ukraine. And here we are, they're there, and his first wife, she was the daughter of the chief rabbi of Białystok. Mm-hmm. He couldn't leave, the people, because he was the head, the chief rabbi of Białystok.
Yeah.
He couldn't leave them alone.
Yeah.
He stressed the point that he wants to stay with them. So he stayed with them. his daughter that was married to my father, my late father, said, I'm not leaving my father alone. And she stayed with him. My father escaped together with his family. And then they did all the arrangements to reconnect, saying that the chief rabbi of Bialystok, Gedalia Rosenman, he spoke with the Archbishop of Bialystok, telling him that the family escaped from Bialystok to Brody.
Yeah.
Please find them a shelter. Find them somebody that will take them. So, the name of this Archbishop, really, in my mind, a holy Archbishop, Chidoko, sent a message or called somebody from his church in Brody and told him, listen, the family is coming, take care about them. Until they find, they make the connection, etc., they found a house, they pay for it, I'm sure, and they lived in Goldaber. I remember everything.
Mm-hmm. Of course, I'm sure you
do. Goldaber Street, number 91 in Brody. Say, okay. Then suddenly, on the 2nd November 1942, there was an action. The Ukrainians and the German entered the city, did action, and they killed at home my late grandfather, grandmother, my aunt. My father pretend that he dead, and they left him. My father took his family and find a place, I think, in a nearby cemetery, Jewish cemetery, nearby his home, because he was from religious family.
Yeah.
He wrote it in his calendar, handmade calendar by him, the day of the death, and it took him 3 days to bury them.
This was all in which part of which part exactly, in which city?
In Brody, Ukraine.
Yeah. Okay.
It's still now Brody, Ukraine.
Okay.
What I'm doing in the last, let's say, 20 years, not all the time, but because, I work a little bit and I'm doing some things. I'm looking for these graves in order to find them and to bring my family
back
home to the land they never ever saw. Maybe they dream about it, but they never saw. I have a help from a lot of people because we don't have a clue where they are. My thoughts are, and the group thinks, because he was religious and because he mentioned the days, because in the Jewish tradition, the first year you so-called celebrate after 11 months, and then later on it's every year. So that's why he wrote it on his calendar.
Yeah.
The main idea that he didn't wrote, or maybe he wrote somewhere, where they are. So we are doing everything in order to find their bodies and to bring them back home.
Do you remember your father when you were 15? You were 15, right?
15
years old. Do you remember the stories that your father shared?
No stories.
No stories.
No stories.
Nothing.
Nothing. Nothing. They don't speak about it. That the child will grow normal. That the child will be not, his soul will not be affected.
Yeah.
What can we do? They were closed. They didn't spoke about it. You know, from time to time, I heard the story, not from my father, I heard it from my mother. He didn't spoke about it.
No parent wants to tell their kid about the traumas of life.
No. Especially the Holocaust survivors. It's a well-known subject, well-known problem, well-known, you know, I'm not the only one that nobody spoke with him.
Yes, Doctor.
It's a very common. They didn't spoke about it. They want to live so-called the new life in Israel, and that the next generation will not be affected at all.
At all.
At all.
Dr. Avi, there's a count, by your own count, if I'm not mistaken, where you have treated more than 10,000 victims of bombings, war, traffic accidents, tsunamis, earthquakes, natural disasters. Is this true?
Looks to me that more than 10,000.
More than 10,000?
For sure. For sure. Well,
why did you choose trauma? Why did you choose this field, Dr. Avi?
I will tell you. When I was a resident, first of all, I'm general surgeon, and I was sure that I will be general surgeon since my 5th year of medical education. There was not even differential diagnosis what's going on with me. I was sure. I work as a nurse, so-called, in the emergency department, and I was in love with the general surgeons.
Yeah.
And the nurses like me, so they let me in to the ORs. So I would finish my duties after 8 hours, and then immediately I went to the ORs, spend their hours to see what they're doing. So I was sure that I'm going to be a surgeon.
Yeah.
That's one. The second, what happened, we had a woman came to the emergency room. She was beaten by her husband. She came, she complained of some abdominal pain, and, nobody, there was nothing to write home about it, so-called, and they sent him home.
Sent her home.
Sent her home. After a couple of hours or one day, she came back. And she said, listen, I have still abdominal pain. I'm not happy. So, the tendency was, keep here. They left him on a bed. And in the morning, they find her dead.
What was the cause?
Looking retrospectively in our morbidity and mortality conference, I remember it like it was yesterday. And I remember the surgeon that was in charge. And I remember the nurse. And I remember everything. And it was discussed in our morbidity and mortality conference. And we came to the conclusion that is a preventable death. In trauma, you have preventable, unpreventable, and potentially preventable death. So that was declared preventable death because she bled from injury to the spleen.
In the spleen.
Yes.
For 2 days.
For 2 days, small injury. She bled slowly, unfortunately but surely, to death. All the hospital, and I personally, I was in state of shock after I understood what's going on. Mm-hmm. And I came to my boss and I told him, listen, I want to deal with these diseases. I want to deal with trauma. I'm not happy with what happened.
Yeah.
It will never happen again. I want to deal with this disease. It's a disease. Spleen, it's a part of the body. However, it was caused by trauma. Today, it's the husband. Tomorrow, it's a road accident. After tomorrow is a terror attack. And today, let's say in our days, I don't believe, I hope that people are dying from splenic injury. Only splenic trauma. I want to believe. Let's say in Hadassah in Jerusalem, I can give you the data. We are keeping everything. It's written, etc. I don't remember that somebody bled from
the spleen
and died. No way.
There's a data that we have, doctor, that I want to share with you.
Okay.
7 people out. Nepal has 7 health workers per 10,000 people. Most ambulances have no medic, just a driver, and patients reach the ER by taxi. We're talking about here. You gave me a solid example earlier. I would love it if we could share that in a while. You built Israel's first trauma unit practically from zero, if I'm not mistaken.
From -0.
From the -0. What suggestions do you have?
Listen, our story is really, it's what I said is trauma against all odds.
Trauma against all odds.
Yes. That's what happened in Israel in my hospital. Everybody was against the trauma unit. Everybody.
Which year was this, doctor?
1990. Let's start from 1990, 1992, etc. Okay?
You graduated in 1973 and in 1980?
No, I graduated in 1980. 80. I started my residency in 1980.
Yes.
I spent it's 6 or 7 years residency, and then I went to Baltimore, Maryland. Shock trauma unit, supposed to be the best trauma unit in the world. And I was accepted there. And I built my career according to what I was there 2.5 years. I will tell you.
Yes.
The main idea is that I was very happy in Baltimore. Very, very happy in Baltimore. My director general from the hospital came to visit me in Baltimore. And he saw everything.
Yeah.
He told me, listen, Avi, don't come back. That's why I told you trauma against all odds. He told me, they love you here. I spoke with them. They admire what you are doing. You're talented surgeon. They love you. Stay there. Don't come back to Jerusalem. There will not be, never, ever, a trauma unit in Hadassah in Jerusalem.
They wanted you to stay at the at Maryland,
yes.
at the university.
Yes.
In Baltimore.
In Baltimore.
What made you go back home?
Just a second. It's not so simple. Trauma against all odds. I wrote a letter to the Minister of Health, the late Motagur, a famous general that was very popular in those days after the 67 war, etc. He was a parachute by his so-called profession. And I wrote him that I want to come and to establish it, all this stuff. And he told me, I have it until now, his letter. Dear Dr. Rivkind, we are okay. The system is okay. Don't confuse us with fact. We are going to continue on the same regime. Have a nice day. Stay in Baltimore. All the best. Greetings, Mota. So, taking into consideration, now I'm here, with white hair and all this stuff. And this time I was with curly hair. Yeah. Curly hair, more black than you.
I'm sure.
Believe me,
Doctor.
with curly hair, not so polite. And you receive 2 no's. Not no, no. With the N, big N, big O, from the people that have to make the decisions.
Yeah.
My director general
wants you to stay.
Wants me to stay. The minister say,
don't
stay,
come.
don't come back. So here we are. And I came back. And I started from zero. Alone. I changed things that were in Hadassah from ever. Head of the departments. I told them, listen, I want, for example, that the chest drain. In the past, the chest drain had inside a metal needle. So you make the incision and then you push
the
needle, and then later on you insert the chest tube. But it's so heavy and it's one direction. So I saw personally that this needle went to the pulmonary artery, to the liver. I came back with the greatest idea, Nobel Prize. I am joking. To take out the needle and to put it with the open incision, first of all the finger, and then insert. You know what? It was revolution in Hadassah.
Nobody had done it. Yeah.
The guy is crazy. Be aware. The guy is totally out of control. That's the simple. The other one was, we had the operation of trauma patient.
Yeah.
And I came out from the OR with a open abdomen. We called it open with a plastic bag. It's called Bagota bag that I saw in Baltimore.
Mm-hmm.
And I came out to the recovery room and my boss told me, Avi, what's that? I told them, listen, it's called bagota bag. That's what they are doing. We cannot close the abdomen. We'll close it later on, and all this stuff. He told me, what? Come. I will teach you how to close the abdomen. I told him, Professor Dur, do me a favor. Leave the woman. Let me treat her my way. And let's see. Give me the chance. Please. You send me for 2.5 years to a place. Don't give credit to me. Give credit to the place. It's not that I invented it. There's something that I invented. But this one, not. It was a regular practice in Baltimore in shock trauma. You know, I begged him. I really begged. He said, oh, you know what? I will keep an eye on her and on you and see what will be. Que sera, sera. Thank God.
She survived.
Thank God, later on, we closed the abdomen and nothing happened.
So the things that you learned in Maryland, in Baltimore, you went back home and you utilized that as much as you can.
As much as I can. Luckily enough, I had a nurse that was convinced by my movement, by my willing, by enthusiasm, whatever. And she told me, listen, I'm interested in this field, and I want to be with you. Unfortunately, her name is Etty. She died, but she was, my right side hand, my left side hand. She fought with me all the wars against this and against the other, and together. And later on, there was another resident. And, you gather together your forces, the pro forces for the trauma unit, but it's a process. It's not revolution, it's evolution.
Dr. Avi, in the same conversation, I'll give you another example. 7 people die in Nepal's roads every single day that we were talking earlier as well. I believe you've created a youth road safety program in Israel.
Yes.
Would you mind sharing that with us?
No problem. And that's also happened after such a disaster. In the high school, in a school near Jerusalem, but in the same area, they celebrate the finishing of the high school.
Yeah, a party.
A party. They went from their place to another place, to a restaurant to celebrate. And on the way, they had a road accident. 4 of them died. 3 on scene, and the other one was brought to us. I remember it vividly now. He was in the recovery room with severe head trauma. Head trauma. Family came, mother, father, and sister. You can imagine, you have to speak with them and to tell them, dilated pupil, no chance to survive, We left him. After a couple of days, he died. It's they are almost 18, 17 and a half. You see the mother, you see the father, and you see the sister. I said to myself, listen, it's very nice that you're treating trauma, etc. However, you should do something to prevent the disease. You know, trauma is a disease. You should treat it like a disease. It's not an event. It's a disease. And unfortunately, it's a common disease. So I came, I don't know, I have the idea. I came to my director general, not the one that told me not, they changed already. I told him, listen, we need to do something to the children of Jerusalem.
Yeah.
We have to create a program that will teach them how to behave on the road, what to do, you have to do when something happened, to give them guidelines and to show them the results of road accidents.
Right.
And I think we are among there is such a program in Australia, and we are the second in the world doing this thing, teaching they are coming to Hadassah in the morning. I'm giving them a lecture about trauma, and then an orthopedic guy speaks about the trauma, and then we bring an injured patient from road accident on a wheelchair that will show them the results. A social worker is speaking with them. We have a program, it's not a program, it's a society that called Or Yarok, meaning green light, that is fighting trauma.
Yeah.
The one who initiated lost his son in a road accident.
No.
So he built all this program, and we show them what happened under the influence of alcohol. We share with them our whole experience every week on Monday morning.
So these are kids who show up? Kids who come for the class?
Kids that came from high schools in Jerusalem to Hadassah.
Okay.
We are preparing them, some drinks. We are giving them sandwiches, voluntarily, totally voluntarily.
Okay.
Only come in.
Share that with us, and maybe next time when you come, this is your second trip.
Okay.
Next time when you come, we'll plan something with the traffic police of Kathmandu, and we can give this a try as well. And that's a great idea as well. There's another thing that you shared with me, which is very close to me. This is called the golden hour principle.
Yes.
Would you mind explaining what this principle is?
Yes. The main idea is, as I explained you before, prevention is the most important thing. Mm-hmm. When you prevent road accidents, no problem. No road accidents. You can sit in the trauma unit, smoke a cigar that I'm not smoking.
You will get out of a job.
No, believe me. I'm a general surgeon. I'm dealing also with esophageal and gastric diseases. Believe me, I have what to do. Okay. Even this night, they called me here in Nepal in order to
get things done.
Get it done.
Yes.
So I'm not worried about this. And in any case, the golden hour, after the preventive measures failed, we have the road accident. The golden hour is what happens from the accident until the EMS, until voluntary people, whatever, is coming to treat the patient. What they are doing in this golden hour. It's based on something that was done in the 60s by the late Dr. Adam Scowley from Baltimore, Maryland, that he saw in the lab. That experience you can never do again. No way it will be approved by the Helsinki committee. No way. No way.
Okay.
Believe me. What he did, very simple experiment. He took dogs, cut the splenic artery, again, the splenic, and gave the dog to die without treatment.
So he took dogs, Dr. Adam took dogs, took out the spleen.
To take the artery,
the artery
to the spleen, and they gave them to blood.
Okay.
And he saw from 100% survival, after 1.5 hours, all of them died.
Yeah.
Zero survival, of course. He came to the idea that, guys, bring me the injured patients from the road of the accident to my unit, and I will save life. Bring them as soon as possible. During this 1 hour, scoop and run, meaning don't play games, bring them here, and we will save life.
So it's the golden 1 hour.
It's the golden 1 hour. It can be extended. It depends what you're doing during this 1 hour. Don't waste the time. You know, in the field, the paramedic, etc., they have 10 minutes for the golden hour. The main idea is to scoop and run, bring them to the hospital, and we will save life. And he saved life.
You rewrote the Bible of blast trauma. I was reading about it, right?
Okay.
Could you explain to me what a blast trauma is?
Yeah. The effect, it's a wave after an explosion. And of course, it depends how much TNT you are putting in the explosion and what you are putting in the explosion. Because the guys, and I can call them loudly, the bad guys.
Yes.
The guys that don't appreciate life. The guys that have, I don't know what they have in the mind.
Evil.
More than evil.
Okay.
Evil is a simple word. Maybe we have to create together
a new word.
A new word. It's unbelievable. And they're putting in the TNT, in our experience, nuts, nails, rat poisoning.
Red poison.
Rat
poison.
Rat.
Yeah.
R-A-T.
Rat poison.
Poison. You know why rat poison? Because it's on the principle to augmentate bleeding. So if you are not enough injured from the blast, the nails, the nuts, etc., over and above,
Poison.
Rat poison. And in some cases, we are not sure there was cyanide.
Cyanide.
Yes. And now, they choose the bomber that has his HIV, HBV, hepatitis.
Yes.
So you have the combination.
They take out the blood and put it in the...
No, because when he was
explode. Oh,
part of his...
You're talking about the suicide bomber.
No, yeah, the suicide bomber. Part of his body, like bone, etc., is entering to the victims. So, for example...
Man.
Yeah, man. Guys, somebody have to speak about it loudly. We change after we figured that that's going on, we changed our practice, and now everybody that are coming to us is receiving vaccination against hepatitis. And if you know that he has HIV, we are treating is as he has HIV.
So make me understand this like a 5-year-old. They're not just putting in TNT, in a bomb, they're not just putting nails, marbles, God knows rat poison, cyanide, but they're also giving it to humans who have
know
disease like HIV.
Yes, they know.
Or hepatitis.
They're choosing them. And from time to time, they are going and they are together with people that, influential people that influence them to be the victims. Because in their mind, they think about that he has HIV, he has hepatitis, etc., etc. So you have the combination, how we say evil. So now we have to find really another word for evil.
So these terrorists, right? So once this happens and the victims come to land in your table, right? What does the Bible of the blast traumas tell you? What have you learned? How do you treat them?
First of all, most of the bombers, not of the victims, in the explosion, they explode themselves, and there is no chance of survival that they will arrive to us.
You get the bombers.
The bombers.
Okay.
Themselves.
The blast trauma anywhere in the world.
Yes, it's the same.
If there's anything similar to this happening anywhere in the world, what should the doctors, all right, the first responders, learn from this? What is your suggestion to people in Africa, in South America, in anywhere in Asia, in anywhere in the world? In the Americas, anywhere in the world. What advice do you have for doctors and first responders, Dr. Avi?
I will tell you. First of all, as you said, nobody is immune. Nobody. It can happen in Nepal, India, of course, Paris, Buenos Aires, all over the world. The one thing is, to the first responders, to the EMS, bring them as soon as possible to medical facility, meaning hospital. Don't treat them, don't waste time on the scene. If they are bleeding to death from external source, like in the extremities, etc., put a tourniquet.
Yeah.
Come as soon as possible to the hospital, because the blast injury is it's divided to primary, the secondary, etc. I don't want to go in details about,
yeah.
But what specific to this primary blast is that it doesn't affect your body, meaning you look from outside pristine. No even small laceration, nothing. It's amazing.
Yeah.
The only thing, if you are very, very excellent clinician, you can see from outside a color that you are not used to see. Like, it's not gray, and it's not blue, and it's not white, and it's not yellow.
Yeah.
You know, only maybe Chagall, the famous Chagall, the painter, or Salvador Dali,
Yeah.
can figure this color. I cannot explain exactly. You see, I don't have the
right
right
words.
Yes, and the right, I don't know what, ideas or imaginations. You know, when they're printing these wonderful things that they are doing,
Yeah.
Salvador Dali and Chagall, or the others, it's a special color. And from time to time, because of the blast, take an imagination that the blast produced, listen good now, 3,000 degree Celsius
Temperature. Instantly.
You can imagine.
Yeah.
It's an unbelievable number, and it's creating external damage. It's creating internal damage. It's unbelievable injuries.
In 1994, you were in Buenos Aires.
Yes.
In the EMIA bombing.
AMIA. It's called
bombing.
AMIA building.
Yeah.
Of the Jewish community.
Did you? I was reading that Argentinian doctors, were treating people in trauma carts as well. I'm sure you know this.
Meaning
they were treating people in a cart as well, right? So from the bombing, what learnings did we get from 1994?
I can tell you what I learned.
Yes.
First of all, when we came, the only, first of all, I have to mention, let's speak for a while, for a second, about something happy.
Yes, of course, doctor, of course.
For me, we landed in Brazil, and the Brazilian team came back with a cup.
Yes.
So I remember it. And later on, I met Pelé.
Oh, you did?
Yes. And he gave me a shirt with his signature. Pelé.
Wow.
So.
That's great.
Yeah. And that was on the way to Argentina. No, I met him later, but I remember it vividly. As I remember what happened in Argentina.
Yes.
We came, the building collapsed because of the bomb, and I saw people digging, dogs looking for, and we sat there in front of this building, and I said, guys, it's endless. It never stop. You know what? I am leaving the scene. There was 100 meters from there a hospital that received the casualties. I went there. I told them, listen, I introduced myself. They were very nice, very polite, and they accept me. Luckily enough, a lot of the patients suffered from crash injury. It's another type of injury that we had the experience in Beirut when they exploded the American embassy.
In Beirut. That was in the 90s.
In the 90s, yes.
Yes, I remember that. In Lebanon, if I remember.
In Lebanon,
Yes,
in Beirut.
Yes.
There were Israelis also.
Doctor, let me stop you and ask you a question. Is it similar to an earthquake collapse? Is it similar to when an earthquake collapses a building?
Yes. Yes.
So is it the same kind of trauma?
The same kind of trauma.
Okay.
Because you are crushed.
Yes.
Under the...
So in 2015, we had earthquake as well.
Yes, I know.
And you were here in 2014, but in 2015, we had an earthquake.
Yes.
You were here for the avalanche.
I was in the avalanche in Annapurna.
So let me bring it all together. In the
Annapurna is another
story. So I'm just putting all of this together. I have limited time. So the earthquake that we had,
yes,
and then the bombing that you saw in Argentina and also in Beirut,
yes,
when the buildings collapse,
yes,
what kind of trauma do you see, and what should people do?
It's a sophisticated, excellent question. It's a sophisticated disease, meaning you are crushed.
Yeah.
And the idea is when you arrive to this guy's whatever, if you can put a needle and to pour fluids, IV fluids, it's wonderful. That's what you can see. Then to evacuate them, because they develop the crush injury damage to the muscles that affect the kidneys. And then later on you need dialysis. And later on you will need amputations. So it's another disease. What happened in the army, we had the experience, and I told the guys, that's what we have to do now. We need to do a fasciotomy, all this kind. I don't want to go in details. But there is and it's not our days that you can use a phone call and you put Google or you put ChatGPT, AI, and all this stuff, and you immediately receive the treatment. There was a paper in the New England Journal of Medicine that was written by Israelis in the north about crush injury. I called Israel. I'd asked them to send me by fax the
papers.
The paper. And I convinced the doctors. They were nice, very nice. And we worked according to the paper recommendation.
Dr. Avi, before I quickly move on towards Kenya and also Sri Lanka, right? I just want to ask, have you ever dealt with trauma related to earthquakes? Why I'm saying this, because we are, where we are geologically,
yes,
the belts that we have, we are prone to earthquakes.
We also.
Not like Japan, but we are definitely in a region.
Japan, it's okay. But the prediction is that Israel will have an earthquake.
Okay. So any suggestions that you have, first of all, for my listeners and also to people who are listening all around the world, as well as to medical practitioners, any suggestions?
First of all, build good building.
Of course.
Again, prevention.
Yes.
Again. It's again and again and again and again. We'll start with prevention. Once it happened, I told you, if you can approach the guys, if you see the hand like this, that's famous pictures, that the hand is like here, and that's the only one that you see. Put a needle, give fluid, only fluids, in order that the system will receive fluid, that the debris of the body, it's called rhabdomyolysis, meaning it's destruction of the muscle, and it's affected the kidneys.
Yeah.
So, it's a circle. So, in order to help, put fluid. First of all, put fluid. Later on, I don't know how long it will take to extract you. It's, then it depends on the weather. There are so many variables that you cannot give, a general recommendation. Then you have to do the diagnosis. By the way, when you put a tourniquet to stop the bleeding, you have the same effect.
Interesting.
If you are not releasing the tourniquet after 2 hours, you have rhabdomyolysis. Another thing, when you put a catheter, to these patients, the urine came like in the color of beer, not the black beer. And don't tell the patient, if somebody is asking you, don't tell the patient that it's because of stress.
Got it. Completely.
It's not stress. It's rhabdomyolysis.
Completely got it. I know, Doctor, you really have to rush, and I've got a update from the team as well. There was something that you mentioned to me about ambulances, but motorcycle ambulances.
Yes.
Could you please touch base on that, and how has it helped Israel and friends in Israel that we could go ahead and do that in Nepal?
Seeing what's happened here.
Yes.
From the day before yesterday, I'm speaking about these motorcycles, ambulances.
Yes.
Guys, we have experience in Israel. There is a voluntary unit called Ichud Hatzalah. I raise my hand. I am the medical director voluntarily. So they are excellent, of course.
Of course.
Of course. But they are doing excellent job on a motorcycle ambulance. They are in 2 minutes, they see the patient.
Search for motorcycle ambulance in Jerusalem?
In Jerusalem.
Yeah, search for motorcycle ambulance in Jerusalem, and then let's show that, and we'll quickly go ahead and wrap up as well.
Ichud Hatzalah. It's called Ichud Hatzalah.
Ichud Hatzalah. So search for this.
Search.
And we would love to show it on the TV as well. And is this the one, the first one?
Yes. No, that's another group. That's Magen David Adom. But it's on the same principle.
Same principle.
That's the principle.
So what does a person have in the box?
They have simple gadgets.
Like tourniquets.
Tourniquets, IV, for intubation. Depend on your level of expertise, of course, because the paramedic has more stuff than the volunteers. It's run by volunteers.
Okay.
The motorcycle is nearby. You are a professor, but you want to volunteer, and you know how to drive a motorcycle. It's nearby. You receive on the pager that something happened in street X, number 1. You are there in 2 minutes.
Beautiful.
And you are saving life. If I can get through this message to the people in Nepal
and around the world.
Guys, it's a life-saving people and procedures. If you are allergic now, what happens if you are now
peanuts, let's say, or something?
Peanuts, milk, something happened to you now,
I'd probably die, but I have you.
No, but I don't have epiphane. I don't have adrenaline to give you.
Yeah, I know.
But if you have a nearby, if not a friend of you, nothing, stranger will come suddenly to you and will give you injection of adrenaline.
And I'll get time to live.
That's it.
Doctor, you really have to, I know you have another event. So one of the last things I want to ask you is, after doing this for more than 40 to 50 years.
Yes. 40, yes.
40 years. When
Okay.
when you reach 120 and you put down your scalpel and you take a break from everything, what do you want people to remember you by?
Lifesaver. Great believer in life. The greatest believer in life on earth.
Thank you so much for your time,
Thank you.
Doctor.
You're welcome.
I'll see you next in Jerusalem, and we'll have a chat more chat over coffee at your hospital.
You are welcome.
Thank you so much, sir.
You can meet me without hospital.
Of course. We'll travel together.
It's not Rivkind equivalent hospital.
Done. We'll
You can
catch
meet
up.
me on the soccer field with Betar Yerushalayim.
Done. And you bring your Pele shirt. And
Yes,
then we'll see
yes.
that. Thank you so much.